Well, good afternoon, and thank you for tuning in to SBAM's Small Business Briefing. I'm Sarah Miller. I'm the Vice President of Marketing and Strategic Communications here at SBAM, and we appreciate you tuning in today. My co-host Brian Callie is on his way, but in the meantime, we actually have a special guest from Blue Cross Blue Shield of Michigan. Dr. Kobernick has joined us for a conversation on the state of healthcare. So, Dr. Kobernick, thank you so much for joining us today. Why don't you introduce yourselves to our audience?
Sure. Hi, Sarah. Thank you. Thank you for having me. I'm quite honored to spend some time with the small business owners. So my background, I'm originally from the Detroit area and have been in the Detroit area except for some time and when I was in the Lansing area at school my entire life. My clinical career spanned 30 years in the emergency department, working for Ascension Health, which became Ascension Health, and included starting 3 free clinics in the community health department in the Detroit area. I have an inclination towards business and population health, and as I was getting ready to leave the emergency department after 30 years, I got a degree in population health from Jefferson College. Population health, the first in the country to achieve that, and really have been here at Blue Cross the past 7 years, really working with my areas. I spend all my time advising employers on strategies to manage healthcare benefits. I lead the population health work at Blue Cross, and I provide clinical input into all the new market solutions. And so I spend a lot of time critically evaluating all the vendors that are ringing our employers' phone off the hook. In addition, I teach at Jefferson. I teach health economics and finance and new models of care. And so that's complementary to this work. So I really keep up to date on where we are today in healthcare. I have a good understanding of the economics and the relationships that are important. So really honored to be here and share some of the areas that I've been working on with your membership.
Yeah, absolutely. It sounds like quite a career, and one that you've been able to really dive into this idea of value too in healthcare. So why don't you talk a little bit about the value and how you define that in healthcare, especially as it relates to our business
Yeah,
owners and
right.
employers?
So value, we typically think of value as cost. And I think in healthcare, everybody really thinks about value as how much things cost and how much healthcare is costing us. Well, some work was done by a Harvard professor, Michael Porter, where he defined value as the relationship between cost and quality. Well, I've changed that. I take some liberties, and it's really the relationship between cost and outcome. So when we're talking about a service or managing a condition, there's a relationship. What leads to the total value is the relationship between the cost we pay something and the outcome, because we really want outstanding outcomes as patients and employers who are providing healthcare. We want the best outcomes, and outcomes, we only can get to great outcomes through understanding the social determinants of health. And so that's really what population health brings to the table, is this notion of you get to the best, lowest cost by addressing things that lead to better outcomes, which are social determinants of health. That's how I describe value. So we're thinking about it not only in cost terms, but in outcomes terms. And then it's how do we measure outcomes?
So, Doctor, it was such a fascinating discussion around value and social determinants of health. But let's start with kind of like a definition of that. What are the social determinants of health?
Sure, those are the things that impact our lives, where we live, what we eat, what access we have to exercise. A common statement is your zip code is more important to your health than your genetic code. That's a common statement that David Nash, the founder of the Population Health School. And so all of those things play into that. So just because someone has health insurance, Brian, doesn't mean they can afford health care or have access to health care. all those factors play into how people are able to process healthcare to get to the best outcome, to get to the lowest cost or the value.
Yeah, so I think a natural place to go then with this discussion next is where, like, what are the strategies,
Yep.
given that these social determinants of health are so key to a person's health outcomes,
Yep.
what are the strategies to rectify or deal with that?
Right. So what we've done a number of things in this area. So we've taken there are national databases that help you understand social determinants of health, and like most areas, it defines take a zip code, for instance, and we can take the individuals that are our members in a certain zip code and look at the zip code by access to care or access to food or education level of the individuals there. We take that data and we bump it up against the individuals in employers, individuals in that area. So I come up with a list in a real practical way. I come up with a list of people at risk based on their social determinants of health and translate it into what we call a barrier index. Then we study the barrier index and determine where are our opportunities to create impact. So if somebody lives in a county where there is limited access to prenatal care and maternity care, and have a high volume of African Americans, we know that there's biases that exist in institutions, and we know that the maternal infant outcomes in the African American community are significantly in need of improvement. So we can identify women that have those barriers and then connect them with a solution. We've done work with a company called Maven that's available to many of our members and employers, and they focus on supporting women during their pregnancy journey. I give them my conversation with them in vetting the solution is if I give you a list of these individuals at risk, do you have scripts for them that teach them how to deal with institutional bias, to deal with educational issues? For instance, they have virtual doulas that have been very successful. They help women find lactation consultants. So we're able to make the connection between the data of people who are at risk all the way to a solution for it. And we're applying that in a number of areas. So it's very exciting work that we're leading and being a part of.
Data-driven solutions, data-driven connections and resources.
Right.
It's something that our audience, I'm sure, will identify very closely with, and how awesome it's happening in healthcare and with Blue Cross Blue Shield of Michigan. Dr. Michael Kobernick, thank you so much for joining us today.
Okay, you're welcome, and thank you.
All right. Yes. Thank you so much. All right. Well, Brian, welcome to the show. We had a few technical difficulties, but you have made it. And now we have a couple of other topics to discuss. Let's start with the outcome of Tuesday's special elections.
Yeah, there were special elections for the Michigan House of Representatives. So this is the state legislature. You might recall that it was very closely divided between Republicans and Democrats, 56 seats for Democrats, 54 seats for Republicans. But then two incumbent Democrats ran for mayor in their respective cities, and they won. And so that meant two seats were vacated. It was 54-54 tie in the House of Representatives for a number of months now. The special elections to fill those seats happened on Tuesday. And Herzberg in Westland and My Song in Warren, who were the SPM preferred candidates, who supported both of those candidates in their primaries. And these are seats that, some seats, like the Republican always wins, some seats the Democrat always wins. These are seats that it's just the way the base of these seats work. The Democrats, whoever came out of the primary was going to win that election. We made endorsements in both of those races. Our two preferred candidates won, and then went on to win in the general election. So they will start straight away. Their terms start right away. As soon as they sign their oath of office, they are in office and could potentially be seated and voting yet this week. So the legislature will be kind of restored back to its position from right after the election last time. And congratulations to the two winners there, and we look forward to working with both of them.
All right, let's move on to the Great Lakes Tunnel Project. There is a new supporter of this project. You want to tell us more?
Yeah, really, as I say, I don't get surprised very often for something that happens in the policy world, and so I find it to be fascinating when I do, and count me surprised on this one. So there was a federal lawsuit that was essentially trying to, in the state of Wisconsin, is where it originated, to try to essentially shut down the Line 5, which is the oil and gas pipeline that runs through the Straits of Mackinac. And the opponents to that have been unsuccessful in stopping it, a new tunnel, a dry tunnel in bedrock underneath the straits. Right now, it lies on the lake bed. The opponents have been unable to stop it there, and so the idea was that it's a trespass on reservation land in Wisconsin is the lawsuit. And the Biden administration actually weighed in on that federal court case and said that when the local judge had decided that the pipeline was trespassing on reservation land, that he had not taken into consideration the fact that there are treaties that govern these things with Canada. So so really, in terms of arguing on the side in favor of maintenance of the existence of Line 5 in the first place, which really there is no alternative to, and we couldn't get by without, at least not anytime in the near future. The Biden administration has taken a position in court that actually happens to match the SBAM position. Definitely not something I had on my bingo card this year.
All right, let's move on to a couple of stories about the economy. First of all is the Consumer Price Index. The latest report is out. What's your analysis? What's going to happen?
Yeah, so I would say that universally there was a lot of disappointment on where inflation stands. So the CPI came in a little higher than what was expected. So 3.8% overall, and so that was actually up. Now it was up for reasons that weren't because of the core inflation. Remember, you've got the CPI, the top line number, is one that's usually in the news. And then if you strip off those things that move up and down quickly and just look at the core items that move much slower and give a better indication overall the way the inflation is going, that was not up. That also was different or a little higher than what was expected, although that trend looks better than the top line trend. So it really did create a scenario where the expectations of a rate cut in the June meeting of the Federal Reserve have been dashed. Now, I did feel like the chair of the Federal Reserve and the vice chair, both in comments that they had made, they did leave the door still open that this was the report for what happened in March. We're still going to see before their meeting what happens in April. We're going to see May, and so the question is, will those show anything different and kind of re-energize the expectation of rate cuts starting in June? But based on this report, it really did not give any confidence that we'll see interest rates start to ebb down. In fact, you saw the longer term interest rates, which are based on anticipated changes in the short term rates. You saw those shoot up. You've seen the stock market take quite a tumble since those numbers came out. So this is, while it wasn't like an alarming report. It wasn't one where it was like, whoa, inflation is totally recharged and it's going in the wrong direction. It was not that type of report. It was more of the disappointment, like we are now several months in a row of just not being able to make that number budge, and it even ticked up a little bit. And so that it's just disappointment, and that disappointment led to kind of a conclusion that everybody had that June was just too early to drop the rates. I thought it would. I took down a couple quotes here. Jerome Powell, the chair of the Federal Reserve, the recent quote, the recent data have clearly not given us greater confidence and instead indicate that it's likely to take longer than expected to achieve that confidence, meaning the confidence to cut rates because inflation is in the right place. So, it's the sort of statement that's not like, the sky's falling or anything. It was just saying essentially that it's a lot less likely that in the next meeting they're going to cut rates. And then Philip Jefferson, who's the vice chair of the Fed, said, while we have seen considerable progress in lowering inflation, the job of sustainably restoring 2% inflation is not yet done. Obviously, it's not yet done because inflation is almost twice as high as 2%. But I thought both of those statements were taking care to kind of moderate the impact, not to sound or look alarmed, but to say, gonna have to hold the course where we're at for a little while longer.
All right. And, obviously there's been a lot of conversation and chatter about the impact inflation has been having on US households overall. And Moody's had a report analyzing that impact. So what did that really show?
Yeah, I thought this was kind of interesting and probably instructive for policymakers that we keep on hearing. In fact, there was a business owner that was telling me earlier today that they were frustrated as they were listening to somebody in one of the regional Federal Reserve banks saying that they're continuously surprised by the strength of the economy and how well it's doing. And of course, it doesn't feel that way especially to small business owners. We've covered extensively that the confidence of small business owners has been slipping for some time now, and there's some pessimism that's building, and the policymakers seem to not be picking up on it. But I think it would be instructive for them to take a look at this report. And now this isn't about business, it's about households, but the typical US household needed to pay $227 more per month to purchase the same goods and services as a year before. So remember, inflation started to be a problem in 2022. So 2023 to 2024. So people are saying, oh, yeah, I mean, but recently hasn't inflation really trailed off and it's not as big a problem? Like, policymakers think of it in those terms. But the average household, for just the necessities, the things that they have to spend on each month, are paying $227 more a month in March of 2024 compared to March of 2023, at a time when supposedly interest or inflation rates were moderating. And while they were moderating, there was no deflation. So these families are still dealing with what happened before. Americans are paying it on average $784 more each month compared to 2 years ago. And then $1,069 more per month compared to 3 years ago. And 3 years ago was when inflation, in hindsight, when inflation started becoming a problem and wasn't recognized for quite some time. Remember that transitory inflation term. So if you were to talk to a household and say, hey, don't you think it's great that unemployment is low and GDP is positive? Must be the economy's great. But that family is saying, just to have all the same things as before, it's $1,069 more a month than when we first came out of the pandemic. That doesn't feel good. And so I think that's this is really the reason why there's kind of a sour mood among the electorate, is that there's a hangover from inflation. And even though rates aren't going up as fast as they were before, families are still struggling to incorporate these increased costs over the last 3 years into their regular budget. And that's where you see that frustration happening. Now you take that and multiply it probably several times. Now that's what a small business owner feels like, that is dealing with a lot of cost pressures from every which way.
All right, let's talk about trash. There's kind of some talk of a trash tax. And can you tell us more about this and what might be happening next?
Yeah, there's a trash tax in Michigan. There is in every state, and it's by ton. So when trash goes into a landfill, there's like landfills are things that have to be essentially monitored and taken care of in perpetuity. And so those who own them, for every ton of trash, there's a tax that is paid. And so in Michigan, it's very low. It's 36 cents. And the proposal in the governor's budget is to take it to $5 to bring, and the way it's described in the governor's budget, to bring Michigan in line with regional averages. Of course, 36 cents to $5 is a pretty big increase. And it's hard. What does that even mean to the average person? But the thing is, our tax is low and it does attract trash in, right? So interstate commerce says you can't just say that people can't bring in trash from elsewhere, and you can't just say, oh, if somebody brings in trash from some other state into Michigan, then charge them the tax, but not your residents. Taxation laws and it's considered a violation of the interstate commerce of interstate commerce in order to if you treat businesses in other states different than in households in other states different than those in your own state. And so you can't just do a tax increase on people from the outside. It affects everybody. And this has really been the rub for a long time, and why it hasn't changed in Michigan. So it's estimated that it'd bring in about $80 million in new revenue. And of that, about 70% of it would be paid by Michigan residents, and about 30% would be paid by some businesses and households outside of Michigan. It gives you a sense, for 30% of the trash in our landfills come from someplace else. So in Ohio, it's $4.75. In Wisconsin, it's actually $13 a ton. So this is one of the proposals, one of the few proposals for kind of an explicit tax increase that's contained within the budget. The governor's budget would use that money for pollution remediation. So what does this mean for any individual? The Detroit Chamber did some estimates on this, and households will pay a total of individual households, not talking about businesses. Businesses, the amount of trash created by a business is so varied, the average means almost nothing. It just depends on industry. But we'll pay about 18 million more a year with the increase, and it would average between $15 or $20 more per household. But organizations like a large hospital would see a pretty substantial increase in the total amount that they pay. So this is one, it's been out there actually ever since I've been involved. When I first came to town in 2006, this was proposed then. It's never actually made it through the whole process. In this case, though, it does seem like there is some growing support behind it. So for an individual family, what you pay for trash, it'd probably make a difference if you pay a monthly bill. Like I pay a monthly bill. I'm not sure how everybody's works. It'd be about $1.50 or so more a month.
All right, well, thanks for that explanation. Earlier this week, GM announced that its headquarters are moving. Where are they headed?
So they're going to stay in Detroit, but this is kind of a big deal. The General Motors has for a long time been in the Renaissance Center because they own it. So this is that big in the Detroit skyline. This is the building that has the center circular building and then 4 towers around it. It's the most kind of iconic or recognizable building in the Detroit skyline. There's a couple other shorter buildings that go along with it as well along the river, but that's been the General Motors headquarters for quite some time. And actually, in their mega credits, some of their economic development credits from before, it was required that one of the agreements that they had to adhere to was that they had to keep their headquarters in Michigan, in Detroit, in that building. And but that was they were relieved of that obligation in 2019 with the renegotiation of their tax credits. And so they are actually going to be moving to the Hudson's building, the new Hudson's building, which the Gilbert organization, Dan Gilbert's company, is building the new skyscraper, the second tallest building in Michigan, second to the Renaissance Center. They have announced that they will be taking the top floors of the new Hudson's building and then the bottom floor for like showroom and products. It's the Hudson's building, which if you've been downtown anytime recently, you see it's, it's as tall it's as tall as it's going to be. It's not finished, but they've got the I-beams up as tall as it's going to be. 1.5 million square foot development. There's about 400,000 square feet of office space. General Motors committed to a 15-year lease for the top floors, but it didn't from what I could see in the press release, it did not include how much in terms of square feet. The Renaissance Center, though, that begs the question: what is going to happen with the biggest building in Detroit then? And General Motors and Gilbert's organization will study it for a year. What are even the options? The building is kind of a monstrosity if you've been on the inside. It's very, very confusing in how you kind of make your way around. I don't think a modern building would ever be designed that way today. So what are even the options, what they could do? Who knows? 5.5 million square feet. 5.5 million square feet. It's so much extra space that the impact that it could have overall on just the vacancy rates in Detroit is pretty breathtaking. Back to General Motors for a minute though. As of July of 2023, the last time General Motors published this, they had roughly 2,800 full-time employees in Detroit. And so this in Detroit proper, that's down from 5,900 5 years ago. So 2,800 down from 5,900. So clearly they don't need as much space as before. And the other thing that I was going to mention is that because workers they're not tied to one place anymore. General Motors does not just announce we have this many employees at that location and this many employees at that location. It's just not how they operate anymore. So that what those numbers that I just gave you really are not numbers that will be available in the future. So very, very big change. And it's when you have a building, especially a big iconic building like that, it's difficult to imagine that in 5.5 million square feet of space. It's difficult to even contemplate what it would take to get that building back to its glory days when it was full.
All right, well, thanks for the report there, Brian. Before we say goodbye today, I want to remind everyone that we will be in Marquette next Thursday. I think Brian will actually be doing the briefing live from Marquette next Thursday. But we have one of our owner-to-owner events. This is an opportunity for you to engage with peers in your area. So join us on April 25th from 4 till 6 p.m. At the Veerling in Marquette. All the details are on our website, sbam.org/events. We appreciate you tuning in today. We hope you have a wonderful rest of your week. We'll be back here Monday at 3 p.m.
Thanks, everybody. See you on Monday.